thank you to the New York Buyers Club for inviting me here. I've been a physician since a lot of years. I'm not that young. So I've been practicing since at least 20 years. And since last 15 years, I've been practicing HIV medicine. So I have a good awareness about that. In the last 7 years or so, I have been practicing integrative medicine, which is the term we use at our center. And it's used at a lot of centers. If you're looking for complementary alternative medicine, probably you should stop looking around with that word. I think you should start searching for integrative medicine, and you're going to find a lot more information. I just want to bring that up. I'm going to talk about my experience in this field with my patients. Not sure a lot of data. I think George covered that portion a little bit, but you can always ask me, and then I can share my email if you want to further, if you have further questions. A little bit about my background in integrative medicine. I have grown up that way, so that's the start. My grandfather had a farm. He grew mangoes, Indian mangoes. If you've never tasted them, you must taste it. Most delicious. And when I was probably around 12, 13, my parents took me and my brother to yoga, and we did yoga for many, many years. And then over the years, we had been exposed to Ayurvedic treatments and homeopathic treatments. I remember my brother used to have chronic sinus disease and frequent colds, and nobody could fix that. No allopathic doctor could fix that, and so my mother took him to a homeopathic doctor, and within like 6 weeks, it was gone, and it's gone forever, completely gone. I remember how he used to be as a child, and he's very different now. He's an orthopedic surgeon. He needs to have a good nose. He can't be bending down over bones and have problems. So yeah, I sort of grown up that way, and then when I came here, I got very immersed in medicine, and residency was a killer. It was really tough. And at that time, there were a number of people dying of HIV/AIDS, and I remember we used to have like 60 patients in the hospital with HIV/AIDS. Right now, I'm going to pick up the service starting tomorrow. Guess how many patients? 4. 4. So that's what HIV is now with antiretrovirals. So anybody who's not on treatment, please get on treatment. It has made a big difference in lives of people I've been seeing, and in our lives too. We are actually throwing ourselves out of business. We actually wonder whether the service is going to continue. If we have like 4 or 5 patients on the service, they're not going to let us run the service. Well, they'll shut down, and they'll be part of medicine. And I hope that doesn't happen, because internists are not adequately trained in taking care of HIV and infectious disease conditions, so that would not be good. But anyway, so that's my background in that. And then so in the last few years, I was getting more and more interested in this field because I was seeing my patients suffering from various conditions, and I would start reading on my own, and I bought a lot of books. If anyone wants some books, I can give away some books. Like plenty in my cupboard, including Dr. Andrew Weil's books and Dr. Dean Ornish and so on, and started educating myself. And then in 2007, the previous manager of complementary medicine left, and he's gone to Sloan Kettering. And some of you here know him, Robert Schmier. And our director offered the position to me, and I said, okay, I think I know something about it, but I'm not formally trained. So then she allowed me to get the training. So I trained with Dr. Andrew Weil's program. I did the Integrative Medicine Fellowship from 2008 to 2009. It was 2 years. And so if you're looking around for a physician who's trained in that, that's available on the internet through the program in Integrative Medicine, University of Arizona. It's a formal training, and actually just last November, this year November, they had the first board certification exam, which was just held. And I'm hoping to take the next one, which is going to be in May. So it's changed a lot, and it's going to be changing even more radically over the next few years. Number of hospitals have integrative medicine centers, and it's just growing rapidly. So let me move on to my talk, otherwise I know I could talk for a long time on this. Okay, so integrative medicine is a combination of various treatments, including allopathic treatments and complementary alternative medicine. And we still mention that because people know about that, know those words, and we use only those treatments where there is some evidence for their safety and effectiveness. It includes conventional and all other treatments, including herbal remedies. But it's not just about giving a treatment, giving a pill, it's about patient-centered care. A lot of people talk about that, a lot of institutions talk about that, but integrative medicine takes it to heart. And we spend a lot of time, integrative practitioners, including some others here, and I'm not the only one here, Peter Pankin, our acupuncturist, and Karina Rimmel are here, and I saw Nina Lawrence, our nutritionist. So we take it to heart. We spend a lot of time. So as George mentioned, we consider the whole person, his mind, body, spirit, and several other things are taken into consideration. There, I'm just going to move on to aging and HIV because that's the topic I want to cover. And I feel aging is multidimensional, and I found various places where they're talking about this. And it's not just about, treating a condition, my blood pressure is well controlled or my diabetes is well controlled and I'm taking X number of pills. No, it's about avoiding disease, avoiding disability, and maintaining good physical function and cognitive function, and being very engaged in various activities. And again, George mentioned that, so thank you. Unfortunately, in the US and now in many other parts of the world, aging is characterized by declining health status and increasing probability of various diseases such as diabetes, hypertension, heart disease, Alzheimer's, cancer, and so on. But this is not inevitable. Alzheimer's is not inevitable. It is preventable, completely preventable, and I can tell you a little bit later about that. Some of it is through lifestyle modification, but several of the supplements and nutraceuticals, which again George mentioned, several of them can help prevent Alzheimer's and maybe even treat Alzheimer's. In most people otherwise, there's increased levels of inflammatory cytokines, mentioned IL-1, IL-6, TNF-alpha, which are mediated by genes activated the transcription factor NF-kappa B. Remember this, NF-kappa B. I'm going to mention it again, and there's one supplement which everybody needs to take to correct that, because that will fix a lot of the problems. Slowing down aging and postponing the onset of age-related diseases may be achieved by blocking this particular mediator. With HIV, there's to some extent, there's accelerated aging, and some of it is because of the virus. If the HIV is uncontrolled, that will cause accelerated aging. And if the HIV is controlled, to some extent, you're going to be able to suppress that aging process or slow it down. But even then, there's some low-grade inflammation, and that's where nutraceuticals will come into play. Diet and other things can come into play. People are living well, living longer, but still do not achieve a normal lifespan. But I actually think this is not really true. This was said in some of the medical sites, but we are seeing people in their 60s and 70s and 80s, and my oldest patient is 79. So, and he's been diagnosed when he was probably in his, when he was around 60 or something, or 56, I think. But if people don't take care of themselves, there's a number of diseases which we are seeing in people with HIV, such as cancers and cardiovascular disease, kidney disease, osteopenia, osteoporosis, liver disease, frailty, which a lot of articles and a lot of studies are being done on frailty in HIV, and that can also be prevented and treated. Most are associated with the normal aging process, but what exactly is a normal aging process? I actually dispute that. over some of this. As we're all mentioned, there's various factors which come into play, like inflammation, drug toxicity, lifestyle factors, nutrition and exercise, toxins in the environment, like in air, food, water, soil. But our soil is very polluted. So let's start there, if we can. Start your own farm if you can. People are doing that. I wish I could do that soon if I retire. Tobacco, alcohol. So all of these can contribute to various age-associated diseases and stress and lack of social support. To some extent, the aging process, because of the inflammation, and that's because of certain other infections often. Of course, HIV is causing inflammation, but people with HIV often are exposed to other infections or have had other infections, and there may be some residual or latent infection which may be there. And this may be causing further decline in T cells. And often there's also an imbalance between the inflammatory and the anti-inflammatory networks in the aging process in people who have had infections, whether it's HIV or other diseases. And NF-kappa-B, again, is a main mediator of inflammation and endothelial dysfunction in the elderly. Okay, so I'm going to talk about areas where I have the most experience, and I have used some other supplements and other nutraceuticals which I'm not going to be mentioning today, but if you want to do another talk together, we can always do that. We can go over those. All right, so some of the basic ones, and these are very important. I think everybody should be able to do these things. So I think, again, I'll skip part of this. George mentioned what happens in the gut. The HIV is replicating in the gut-associated lymphoid tissue and causing rapid depletion of the CD4 cells during the acute infection. And these do not reconstitute very well after heart. And so we have to do something else. And I do recommend probiotics and other things, including probiotic foods. A lot of the inflammatory markers are increased in people with HIV. And with heart, these inflammatory markers do decrease, do improve, but they're not completely resolved. They don't completely go away. Treatment with heart is recommended for everybody now. Early treatment is recommended. Side effects are minimal with the newer medications. A number of people taking Stribil, doing very well. There's less risk of diabetes, hyperlipidemia, neuropathy, and gastrointestinal side effects with currently used medications. And if side effects do occur, they can be effectively managed with lifestyle changes, supplements, or acupuncture, or other approaches. I have a few case reports. This is a patient of mine who developed diabetes in 2006, and I've been already seeing her for a few years. And I told her there's like two options: either start taking some pills or insulin, or follow the diet I want to recommend to you. And she said, okay, I'm taking a whole number of other pills. She was taking 3 medications for HIV at that time. And she said, okay, I'm willing to try this out. So we worked together. She saw our previous nutritionist a couple of times. And within 3 months, her hemoglobin A1C dropped from 10 to 7. No drug can do that. Not even insulin. No drug, no insulin can do this. And this is not updated, but her A1C is about 6.2 now. But look at it, from 10 to 5.5 with just diet. A little bit of exercise, not a whole lot, but mostly diet. And I have other patients too who have dropped A1C from 7 to 3.7, was it?
Yeah.
Yes, 3.7.
Yeah.
I show it to physicians, doctors, residents, they get shocked. Eyes like pop open. 3.7?
Yeah.
This is another patient of mine who he's been followed at our center for a very long time and struggling with obesity, liver enzyme abnormalities, and myself and the nutritionist, we spoke to him in September. That was the first time I met him. And talked to him about just regular food. He'd been trying other kinds of diets and they were not really working. So we just talked about food and started doing lots of fruits and veggies, and nuts and seeds, protein shakes, turmeric, huge, and more. And he lost weight. He's lost almost 50 pounds now, I think. Right? 50 pounds in the last 1 year. Continues the same diet. He eats a huge salad every day. He makes these shakes with smoothies with fruits and nuts, protein powders, and he has this huge watch with very large links. And he had to remove a few links because they were just falling, and the watch was falling off. Yeah. This is another patient who a few years ago had come to me with HIV and AIDS and reactive arthritis. So, pretty serious condition. People need intensive treatments, steroid injections. He was receiving steroid injections with an orthopedic surgeon. And he talked about nutrition and told him to cut out all the processed foods, increase fruits and vegetables. He said after he started doing that, his friends did not want to come over. They didn't find any cookies or other things. He works in a college, so he has a lot of young friends. And then he also started taking a few basic supplements, not a lot, just a turmeric, and he takes holy basil, which hasn't been mentioned, tulsi. It's amazing for stress. It's an adaptogen. And there are a few other adaptogens which help us fight off infections or stress. This is one of them. He drinks that a few times a day. And he also does brief meditation and relaxing breath, and I am going to lead you through a couple of minutes of this later on. And this has really changed his life, and he's not had pain since more than 4 years now. And he runs a few miles per week. He regularly does the New York Roadrunners races every year, a few of them every year, at least 5 miles he runs. And the other interesting thing is that his mood and attitude, energy levels, everything improved, and family and friends noticed that he was nicer, less irritable. This is about diarrhea. There's multiple people who have responded with various recommendations, various integrative recommendations. Just a couple of examples. This is the first one is a patient with HIV and AIDS, history of stroke due to varicella zoster and diarrhea. CD4 was still low at that time. He came to me, referred by another physician. All the physicians refer patients to me, so they're very accepting of the kind of care we offer. Integrative team is to offer. So his diet is resolved after adding zinc supplements. So we haven't mentioned zinc, but zinc has been studied extensively a while ago, not recently, but some time ago. And there's been great studies showing improvement in CD4 count to some extent, improvement in immune function, resolution of diarrhea. And the resolution of diarrhea is not only in people with HIV, but even other kinds of infectious diarrhea, like cholera. And there was this talk about cholera in Haiti. There was reports about like zinc being used because there are benefits in many other diarrheal conditions. Second patient is a patient with HIV and AIDS and chronic diarrhea. He's been worked up literally top to bottom, like all the way down to the bottom, including having colonoscopy twice. And he had consulted me. He was actually probably referred by our acupuncturist sitting here. Somehow he got to me. So we talked about various things, and I felt there was a food which was contributing to his diarrhea. As soon as we pulled out that food, it just went away.
What was that?
Which food was it?
What was that? People at my center cannot respond to that.
Oh, okay.
Cheese.
Guess. No?
Wheat.
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 That was it. It went away. And several other patients with various other conditions have complete resolution of their condition after stopping wheat. If you have something going on, try it out. Stop wheat, gluten completely for 4 to 6 weeks, and then reintroduce it and see what happens. It can cause a lot of disturbances, including gastrointestinal disturbances like irritable bowel syndrome, inflammatory bowel disease is related to wheat and gluten. There's certain skin diseases like psoriasis are related to wheat and gluten. Certain neurologic diseases, multiple sclerosis, and several other neurologic conditions may be related to wheat and gluten. Some of it can be tested. There's testing for celiac disease, but that's only 1% of the population. It's estimated by most integrative practitioners that about 30 to 40% of the general population has some level of gluten intolerance or wheat intolerance. Just try that out. If you have any problem at all, try stopping that.
Do you put beer under that category?
Which one?
Beer?
I think so. Yeah, he had a question about beer. I remember.
But I
It's
think it
impatient.
is there.
Yeah, so he had to stop beer too. So if you can tolerate it, right? If you introduce it back and you didn't see a change, then I would say cut it down anyway, because people are consuming a whole lot of wheat and it's not good for other reasons, and especially avoid flour-based products, bread and other flour-based products, except there's only one type of bread which I personally would eat or I recommend to my patients, and that's sprouted grain bread. Some people may know about it, Ezekiel. There's probably another one or two with Ezekiel. I love that.
Is it sprouted wheat or sprouted grain?
It's sprouted wheat, but there are other grains
Yeah,
too.
okay.
Mostly the first ingredient is wheat. And they have legumes in it and some nuts and seeds and a few other things in it.
All sprouted.
All sprouted, yes.
Flour.
Does wheat
It's
germ,
flourless.
wheat germ qualify as wheat?
Oh, yes.
Yes.
It is the essence of it.
Yeah. Wheat germ, crack wheat, wheat berries, all of these, they may
For
be good at,
ages
if
you
you
heard
don't
about
have a
how
problem with
healthy
it,
it was,
you
yeah.
could eat it, if you don't have a problem with it. But I would encourage you to just test it out.
Tabbouleh, couscous.
Couscous is also wheat. Yeah. Tabbouleh, yeah. Neuropathy, I think I already mentioned. Oh, certain types of neuropathy, not HIV neuropathy, certain types of neuropathy are related to gluten intolerance. So if you have neuropathy, again, try stopping wheat and see what happens. I want to move on to the other topic, which is stress and social support and all that. Again, on social support, I want to mention that something which has changed my life. In the last 2 years, about 2 years ago, we encouraged, meaning our team, encouraged a few of our patients to participate in a 4-mile race, New York Road Runners race. We entered them, we paid for them, and they said, okay, they're going to do that. And they started exercising, and they decided they would walk it. These people were obese at that time. And I said, okay, if they're going to walk it, and they're going to do 4 miles, I should see if I could run it. So I started running, and that has changed my life. So I run with a group, run on my own. I go to the New York Walkers Club on Saturday, and everybody's welcome to join. It's $20 for the year membership. They meet every Saturday. It's a wonderful social occasion. I love it. 2 of my other colleagues, one physician and nurse practitioner also